Good evening, everyone. My name is Jen Del Huerto, and I am board chair of Just Trying It. Thank you so much for joining us tonight for a special conversation with Dr. Shad. These are very uncertain times for all of us, but especially so for those families who have a child with cancer. At JTI, our mission is to support our families fighting cancer to help them financially so that they can focus on their child and treatment. We also want to support our racer community during these trying times. We want to bring people together to get active and stay healthy mentally and physically. When we decided to go virtual, we knew it would be hard, and we were thrilled with the support we have received from our community. Thank you for that. It is my pleasure to introduce one of our greatest champions and a lifesaver for so many of our families, Dr. Aziza Shad. Dr. Shad is the Ellen W.P. Wasserman Chair of Pediatrics and Chief of Hematology and Oncology at the Herman and Walter Samuelson Children's Hospital at Sinai. Dr. Shad is also Professor of Pediatrics and Oncology at Georgetown University School of Medicine. Dr. Shad is also the co-founder and medical director of the Aslan Project, which provides treatment to children with cancer in Ethiopia. I will now turn it over to Maureen Colburn, Just Trying It's Executive Director, to begin our conversation with Dr. Shad.
Thank you, Jen. Well, Dr. Shad, I think we should just jump right in. So my first question to you is, how has your life changed in the past 8 weeks? And what have you seen at the clinic? What have you had to put in place to really support our families fighting cancer?
The COVID crisis came on so suddenly, I don't think any one of us was really prepared for it. And so life changed dramatically. Within a matter of a couple of weeks, we had to change the way we practiced medicine. And instead of going to work from 7:30 in the morning to 8 in the night, we suddenly had to be masked. We had to learn how to don and doff if you were seeing a patient with COVID, which means wear the whole apparatus that you have to wear if there's a patient with COVID. We had to practice social distancing. We had to make sure that anyone who walked into our clinic washed their hands. We had to make sure that cleanliness was ultimate in clinic. And more importantly, since this COVID pandemic affected the adults much more than children initially, although now it's a different story, we had to make sure that we decrease the number of patients being admitted to the hospital, aside from those who were getting chemotherapy or who needed blood transfusions, so that if the adults needed beds, we could support that mission as well.
Mm-hmm. I know that must have been very difficult for the patients coming in, having to limit the numbers that are coming with them. What have you seen is the greatest need from families, that are coming in now who you're dealing with in the clinic? Like, what are the things that our social workers are hearing, that you're hearing from families about the challenges they're facing?
So you're not going to believe it. A large number of our families come by Uber. And that is one of the things that, thanks to Just Trying It, we're able to provide our families that come from inner city Baltimore who may not necessarily have transport, because kids who are getting chemotherapy should not really be taking and changing 2 buses and a train to get to the hospital. We found that we could not utilize Uber anymore. Uber was no longer willing to bring patients with COVID-19 or suspected COVID-19 or patients who were untested to the hospital. We could not get any lift to bring them. So we had to make arrangements of other sorts. We had to make sure that the hospital could provide special transportation so that we could bring the children in for chemotherapy. How lives have changed. Parents have lost their jobs. Some of them are on furlough. Kids are not in school. If one child needs to come to the hospital, the mother doesn't have anyone to babysit the other 4. Previously, they could bring a couple of kids with them when a brother or sister was getting treatment. They can't do that anymore. It's been really hard for them. So, bills have suffered, mortgages are unpaid, apartment rents are not going, electric bills. I just sanctioned a whole bunch of things that I signed off on today, just for people to survive. We've been able to get them groceries, and we still have some cards available that we help them out with. Our social workers constantly calling every family to see how they're doing. We are worried that domestic abuse is going to go up in homes. the social isolation. And in terms of the cancer survivors, while I was getting ready for this event, I was talking to one of my cancer survivors in California. They are reliving the stress of what happened to them during treatment. The anxiety is so great. So we've started online counseling for those families as well.
That is something I wanted to pivot to. I think one of the things for all of us, who are home, is like, even if the physical toll of COVID is not taking its toll, there's really a mental and emotional toll, especially for children. Do you have any strategies for families about how to talk, whether their children are in treatment, or if they're survivors, or just those of us with kids at home who are not used to not being around other people? Suggestions for them?
One thing that we found is that families, in spite of everything that I described, have come much more closer to each other. So parents actually being home are doing more stuff with their children. I'll give you my own example. Since I do telehealth a lot now, we've got to stay in touch with our families. Those who need to come in for treatment, we bring them to the clinic. The rest of them, Thursdays is my telehealth day. So from morning to evening, I'm calling our families. They come on the video. They are more relaxed in their homes. They describe what they've been able to do with their children. They pulled out old games. They look at old photographs. So parents and children are communicating much more. But there's a sense of social isolation too. I mean, how many times can you FaceTime somebody?
Mm-hmm.
At some point, the children want to go out and meet with their friends. And those are the things that we have to figure out now.
And that gets to another question I had, which was around, we've started to reopen. Maryland and Montgomery County is entering phase 1. Maryland's entered, I think Baltimore City is probably soon as well. What are some things that we can do to continue to protect? And of course, we're all particularly conscious of protecting those who are vulnerable, and making sure that we are there to help and support. So do you have any suggestions about what we can do and how we can safely kind of re-enter society?
I keep telling people that this is not something that's going away in a month. It's going to take realistically about a year to a year and a half before we get back to where we may have been. And we may never get back to the pre-COVID era, depending on when a vaccine comes into place and when we can control it. But what we can do is we can get used to a different kind of a life. I keep reminding people, wash your hands as often as you can. Keep sanitizers with you if you can. Use social distancing. It really means a lot if you can stay 6 to 10 feet away from somebody, and do not forget to wear your mask. The mask protects you from somebody else. It protects the other person as well. So if both people are wearing masks, if you are practicing social distancing, and if you are keeping your hands clean, I think that's the best protection for anyone.
And I know that you also talked about how COVID-19 has really laid bare a lot of the inequities in our healthcare system, and other areas that you've seen in your practice where families, whether they're in treatment or not in treatment, are really impacted by COVID-19, immunizations, concerns about other things, access to healthcare.
It's huge. The figures came out from the state of Maryland, the health department of Maryland. 72% of children at younger ages, and that means less than the age of 5, are not immunized or are behind on their immunizations. And families are not willing to bring their children back into hospitals or clinics because they're so scared that, they protected them at home. They may catch the virus if they bring them in. So how do you get around this? Many pediatricians have started morning hours. So in the mornings, they see well children, they bring them in for their immunizations. My own granddaughter goes early in the morning to get her shots. In the afternoon, they see the sick kids. So in Baltimore, because already there's a lot of inequity in the population over there, parents definitely do not want to come. Transportation is an issue, finances are an issue. They may not even have enough masks in their house, to be honest. So at our hospital, at our children's hospital, we are starting an immunization project where we're going to be taking a van out into inner city Baltimore to their homes and go outside their homes and immunize their children, and if possible, examine them as well. This will be part of a much larger project that we're working on, the mobile van project, that will hopefully become a reality in a year. that we will have a clinic within a mobile van that can go into the inner city of Baltimore, into the areas where children don't come for their visits, where non-compliance is a huge issue, and take care of them. So some good things have come out of COVID too. I think the realization of the inequity is very blatant right now.
Mm-hmm. I have a couple more questions, but is there anything that I haven't asked you about that you think is really important for our community to know, like as we get together, as we begin to go out, as we're caring for our own children, as we're thinking about the cancer community?
I think the one thing that became very obvious to us as this crisis began was how important it was for us to have support of foundations like yours. Because at this time, when families are truly hurting, families that are impacted by cancer or by chronic illnesses or by life-threatening illnesses always have a hard time. And those are the families that you were helping anyway. Right now, every family needs help. And if we hadn't had the support of Just Trying It and other foundations that constantly help us with the gift cards, that help us with transportation, that help us take care of their bills, that help us from preventing eviction, I don't know how we would have been able to do it, because hospitals are hurting. When there are no patients in the hospitals and the only patients there are COVID patients and nobody else is allowed to even enter the hospital, those hospitals are going to collapse unless the state helps. So this is secondary. And the fact that we have support has made it much easier to take care of our patient population. And I have to admit, people have been very generous.
That's wonderful to hear. I mean, that's why we've made it one of our priorities to make sure that we can commit 100% to fulfilling our budgets for this year, make sure we get the money out to the families. We have a question from one of our participant attendees, and so I'm going to take more questions. If anybody has them, please feel free to put them in the Q&A section on the webinar. But this question is, have you seen pediatric cancer patients or survivors that have had COVID, and how have they done?
So there have been about 3 or 4 patients in the city of Baltimore who were on active chemotherapy or had just finished chemotherapy and got COVID. And thank God they all did well. So, when you bring up this question of COVID, let me just say a couple of words about this other viral syndrome that we are now beginning to see in children. So it seems like initially we thought it was only the adults and the older adults over the age of 65 that were probably going to bear the brunt of the disease, and that the younger people could get away and survive and get much better. Recently, about 6 weeks ago in New York, they realized that children were getting sick. And children could have been a few weeks old, they could have been a few years old, and they were presenting with either tummy pain, diarrhea, fever, rashes, runny noses, colds, and coughs, and developed this condition which we are now calling MIS-C, which is the multi-system inflammatory syndrome in children. So all pediatricians have been notified. Every healthcare system in the country has notified everyone who needs to be notified. If anybody's child has a fever that lasts for 2 or 3 days, or you have a strange rash or any abdominal complaints or respiratory complaints, take them to your pediatrician right away. And I have to say, those are the kids that we've admitted quite a few. We've admitted about 7, I think, in the last week or 10 days. All of them have done well. So the important thing to remember is it does happen, but most kids do well.
And how about in terms of with parents with COVID who then are in danger? I mean, who is taking care of kids when parents are diagnosed? Have you seen that?
When parents are diagnosed, it's really hard, because if the parent is in the hospital, they have to find someone to take care of the kids. The parent eventually goes home. The children, thank God, even if they are COVID positive, are in self-quarantine. They're all quarantined at home, and they all seem to do okay. For example, we've had a lot of pregnant mothers who were asymptomatic COVID carriers. They didn't even know. We test every patient that walks into the hospitals. When women come in labor, we test them. And we found several asymptomatic women who were about to deliver who were COVID positive. So initially, the guidelines were to separate the child from the mother for a couple of days at least, but eventually the child has to go home with the mother. And now the rules have changed and CDC has given out new guidelines and the baby should stay with the mom because the baby generally does well. They go home, they quarantine for 14 days and everybody's done well so far.
And what about testing? I think we've heard a lot that it's important for people to get tested. So what is your recommendation in terms of people who, feel what don't know if they have it or don't have any symptoms? Is there still a kind of a tiered testing system? Is it something where healthy people should be going out to get tested just so they know?
So there's different kinds of testing. For example, for any surgical procedure that you come for, be it something mild like a sedated MRI for a child or a spinal tap or a bone marrow, or you're getting your hernia out or you're getting your hip replaced, you have to have testing done because it doesn't mean that we do know that patients who are COVID positive don't do very well post-surgery. So you have to make sure that you're COVID negative when you come for your surgery. So that's one kind of testing. The second kind of testing is going out into the community and getting yourself tested just to know what the prevalence of COVID positivity is in asymptomatic individuals, because that tells us how widespread COVID is in Maryland, for example. And the third kind of testing is antibody testing, which is what all of us as healthcare providers are going through, because we need to know if we're antibody positive or not. Number one, being antibody positive means that you may be able to help a COVID patient by giving plasma. So far at LifeBridge, of all the healthcare providers that have been tested, only 2% have been found to be positive with antibodies.
Oh, that's interesting.
Yeah.
That's interesting. I don't know if anyone has any other questions. Feel free to put them in the chat. I had one kind of final question to wrap up on we just got another one in. What would your advice be now that the state is opening up again? We had talked a little bit about this, but kind of for the regular folks or people who are formerly had cancer but are recovered, kind of what's your advice to them in terms of their precautions and opening up?
Live a normal life as far as you can. Go out into parks or open places, put your mask on, observe social distancing, walk, exercise. If you have little kids and you have close friends who are social distancing, who are taking care of themselves, who are quarantining, and you want to get together with them, do it on your patio. You can still observe all the rules. Kids can still see each other. They can still talk to each other. The problem is going to be social isolation. There's going to be social isolation. That's going to be the next problem we're all going to have to deal with. And since we have to learn to live with this, let's learn to live with it safely. So taking care of yourself and taking care of somebody else while you can still talk to them and see them would help. Grandparents are suffering, they're really suffering. Old people are unable to see their grandchildren. People are finding different ways of doing it. I know for Memorial Day, one of my cancer patients who really misses her grandma said to me, I need to let you into a little secret. We brought grandma over, but she had herself tested first. She was tested, she wore a mask, she sat on our patio, she sat far away from me, but at least I could see her. So we have to learn to live a different kind of a life. So if we protect ourselves, there's no reason why we couldn't bring some normalcy back into our lives.
I think that's a message that we need to hear to help people start to be safely together again. I think that's something that we haven't necessarily heard from our civic leaders about. We hear a lot about the finances and the business and wanting to get people out in the community, but we don't hear as much about how we can connect with one another safely. I think that's really important.
Yep.
So can you share with us, it's been a tough couple of months for everyone, and particularly for you, and I'm sure your staff, and everyone at the hospital, in terms of the fear that comes with being in a hospital at a time like this and going home to your own family. So what are a couple of the bright spots that you've seen over the past couple of months? What are the things that kind of made you smile, made you feel like, okay, we are coming together? And I think that's a good note for us to end on, with me to kind of talk through those and get that out there.
I'm in a unique situation, and I know there was a question there too. So,
yeah.
So my mom, who's 91, And my uncle, who's 87, decided to come and visit me 3 weeks before COVID. And we had no idea that the flights were going to stop. So they're living with me right now. And I'm a healthcare provider who goes to work all the time in a hospital setting. So two things happened. Number one, I've never been cleaner in my life because I have to come back, literally strip in my garage, go straight to the bathroom, take a shower, then I can mingle with them. Since I do a lot of telehealth from home right now, I see them for breakfast, I see them for lunch, I see them for snacks, something I would have never been able to do. But for me, the brightest spot has been paying attention to my backyard and my garden. I didn't even know the amount of flowers that came out in my garden because I left early in the morning, came back at night. And I have followed from the cherry blossoms, the daffodils, the cherry blossoms, the irises, the azaleas. And right now we've got hundreds of peonies. I've heard more birds chirp than I've ever heard in my life. I've seen more greenery than I've ever seen. So there's always a bright spot to everything. And I think that's what we need to enjoy. Enjoy the time with our family, enjoy nature, take care of your health. Those are all good things. So sometimes in the middle of a very difficult, dark time come some really good things.
I agree. I mean, I think there's been a family of baby birds nesting outside my window, and I've invested so much energy in making sure that those baby birds safely left the nest after 2 weeks. And fortunately, they all got out there and made it. So I think that's really important then. And even my son, who's 8 years old, said that he had to write an essay and said, it's so nice to spend so much time with my family. We're always rushing around. We're always doing so many things. And it's great to just be together. And I think that's a really nice, a nice positive way to end. We've gotten some other comments, but they're just thank yous. And this has been wonderful. So I thank you so much, Dr. Shad, for sharing your wisdom with us. And we're so grateful for all the work that you and your team are doing, and especially your social workers are helping us to connect with families and make sure that our dollars are getting out there where they're needed the most. And I want to take this time now to introduce Caroline Kettering, who's a member of our board, and she's going to share with us a little bit more about what we can do to support Dr. Shad and other healthcare workers in the community, and how Just Trying It has pivoted over the past couple of months.
Thanks, Maureen. So once again, we want to thank all of you for joining us tonight, and especially to Dr. Shad for sharing her insights with us. That was really valuable conversation, and my heart pitter-pattered more than once during that. So thinking about the impact that Just Trying It has in the community, the thing I think I love the very most is that it's really a cause that we can support as a family. So I'm a mom, I have 2 little boys. And so for me, Just Trying It isn't about just writing a check, though of course checks are welcome. It's really about families helping families, and what is it going to look like this year. And I think we have pivoted to make sure that we can still hold our events, maximize our support so that we can continue to support the families with the kids that are in the hospitals, and support the hospitals that support those families. So we've made a commitment to fully fund all of our hospitals in 2020. Our families need us now more than ever, and so we're really, really focused on that as a board and as an organization. We're working with our distribution partner to make sure that we have a less than 48-hour turnaround on the money that goes to the families, knowing that they're in a time of need and we're able to help them. So we're grateful for that. And we're really, really focusing on the ones that have been impacted by COVID-19. It's a huge impact in so many ways to so many different people that we think that helping those families specifically is a way that we can be of support to the community. So if you're sitting there today and you're thinking about ways that you can get more involved to support Just Trying It and help us meet those needs of our family, register for our virtual triathlon. It's June 21st. It is all ages and all abilities. So my family's so excited. So I have a 6 and an 8-year-old, and my 6-year-old has some special needs that may have precluded him from doing a regular mini triathlon, but this year he can participate and he is over the moon. So it's gonna be really fun. My family's gonna do a bike ride, a nature walk, and we're gonna do an obstacle course. And so I don't know if it's going to be more fun to watch my 6 and 8-year-old do it or my 39-year-old husband do it, but I'll get back to you guys. So if you don't want to participate in our virtual triathlon, you can sponsor. Maybe you know somebody who has a company that might want to sponsor, someone who just wants more information about the work that Just Trying It is doing. Please reach out to us and put us in touch with them. You also are welcome to make a donation to our COVID-19 fund. We would love your support in any way that you want to give it. I'm going to wrap up and say thank you all for coming out again tonight to spend a little bit of time and listen and learn from Dr. Shad. We're really grateful for all of your support, and I hope that you have a great evening and stay well. Thank you.
Thank you.
Thank you.
Take care all.
Thank you.